The basic functions of bone can generally be summarized into 5 main areas as follows. Support. Bone provides support in rigidity to the soft tissues of the body so that our normal erect posture can be maintained. Protection. Bones help to protect more delicate vital organs which they surround, such as the protection provided to the brain by the bones of the cranium. Movement. Bones serves as levers or points of attachment for the body's muscles, which pull on the bones and result in movement. Storage. Bones serve as a warehouse or storage areas for important minerals in the body, such as calcium. When blood calcium level rise above normal, the calcium moves into the bones and it is stored. When calcium levels in the blood fall, some stored calcium leaves the bones and enters the bloodstream to be used throughout the body. Hemopoiesis. This term is a combination of the Greek words hemo, meaning blood, poiesis, meaning to make or manufacture. Blood cells productions occur primarily in the red bone marrow of the body. As shown in the book, Table B, Outline of the Skeleton, the first one will be the axial skeleton, and there's a total of 80 bones. There's the skull, which has the cranium, face, ear bones, hyoid bone, the vertebrae, ribs, and sternum. And then the appendicular skeleton, and that has a total of 64 bones, and it has what it's called the upper extremity pectoral girdle, and that has the scapula, clavicle, humerus, radius, ulna, carpals, metacarpals, and phalanges. Os coxa, femur, patella, tibia, fibula, tarsals, metatarsals, and phalanges. The human skeleton consists of 206 classified bones, and they are generally grouped into 2 main subdivisions called the axial and the appendicular skeletons. Classified bones are those which are always present in the normal human body. The axial skeleton includes all the bones of the skull, the hyoid bone, the thorax, and the spine. The appendicular skeleton includes the bones of the upper extremities and the pectoral girdle, arms, wrist, hands, fingers, collarbones, and shoulder blades, plus the bones of the lower extremities and the pelvic girdle, which are the legs, ankles, feet, toes, and hip bones. Besides the 206 classified bones of the body, there are 2 other recognized types of bones, which are very irregular and may or may not be present in a given individual. The first of these, quote, unclassified, unquote, bones are called sutural bones, which are small, chip-like pieces of bones sometimes found embedded between the cranial bones. The points at which the cranial bones meet are referred to as sutures. The other type of unclassified bones are called sesamoid bones. The word sesamoid literally means resembling a sesame seed. By definition, these small variable bones are occasionally found embedded in the tendons, most often at points where the pressure exists, such as where a tendon moves over a bony prominence. The kneecaps are exceptions in that they develop in and are surrounded by tendon that are present in all bodies. Thus, they are classified as sesamoid bones. The skull, which contains 28 bones, may be subdivided into 3 categories: the cranium, the face, and the ear bones. The cranium consists of 8 bones, which form the cranial cavity in which house the brain. The frontal bone forms the forehead area, the front top in the cranium, and the upper part of the eye sockets. Important landmarks of the frontal bone include the supraorbital margins, or the upper rim of the eye sockets, the superciliary arches, which are the elevations and above the medial ends of the eyebrows, the glabella, which is a prominence just above the nasal bones, between the medial ends of the eyebrows, and the frontal eminences, which are described as gently rounded prominences at the upper border of the forehead. Also contained within the frontal bones are the frontal sinuses, which are the cavities that communicate with the nasal passages. The parietal bones form the majority of the upper sides and top of the cranium. The temporal bones form the lower sides of the cranium, basically surrounding the ears. The upper flat portion adjacent to the parietal bones is called the squama. The inferior or petraeus portion includes the hearing canal and houses tiny ear bones. The zygomatic process is a projection on the temporal bone which extends forward anterior to the hearing canal to unite with the cheekbone. The mastoid process is a prominent projection on the inferior part of the temporal bone, just behind the lobe of the ear. The external auditory meatus, or hearing canal is a tunnel in the temporal bone, which extends medially from the external ear to the middle ear. The mandibular fossa is a depression on the temporal bone just anterior to the external auditory meatus, which articulates with the condyles of the lower jaw. The carotid canal is a passageway in the temporal bone, which the internal carotid artery passes in taking blood to the brain. The occipital bone makes up the lower back part of the cranium. The large opening in the inferior portion of the occipital bone, through which the spinal cord passes to connect to the brain, is called the foramen magnum. The occipital condyles, located in either side of the foramen magnum, articulates with the top bone of the spinal column. Also, the prominent tubercle on the posterior surface of the occipital bone is called the external occipital protuberance. The Sesamoid bone is sometimes described as the bat-shaped bone. It helps make up the floor of the cranial cavity, the back of the eye sockets, and part of the temporal area. One of its prominent landmarks, Skeletal, which is depression in the center of the superior portion of the sesamoid, in which holds the pituitary gland. In addition, the Sesamoid bone also contains the paranasal sinuses. The Ethmoid bone is a very irregular shaped bone, which helps make up the floor of the cranial cavity, part of the eye socket, in the upper part of the nasal cavity. It has a number of important landmarks, including the cibriform plate, which is the flat superior surfaces of the ethmoid, which is involved in making up the floor of the cranial cavity. It contains many small holes for the passage of nerves into the nasal cavity. Also, the ethmoid contains a noticeable vertical projection on its superior portion called the crista galli. The crista galli is so named because it is thought to look like a rooster's comb. The vertical or perpendicular plate of the ethmoid is a thin, flat plate of bone which extends down the nasal cavity on the midline and helps make up the nasal septum. The ethmoid bone also contains paranasal sinuses. The face is the second main subdivision of the skull and consists of a total of 14 bones. The nasal bones are two small bones making up the area we commonly think of as the bridge of the nose. The two lacrimal bones are located in the anterior medial portion of the eye sockets. The word lacrimal comes from the Latin word for tear. The Vomer bone is located on the midline in the base of the nasal cavity, along with the perpendicular plate of the ethmoid bone. It helps form the nasal septum, which is the wall that divides the nasal cavity into right and left parts. The zygomatic or malar bones are commonly called the cheekbones. They also help form the eye sockets. The Palatine Bone are two small bones which help form the posterior part of the roof of the mouth. It is from these bones which we get the commonly used word palate, which refers to the roof of the mouth. The Maxillary Bones are the upper jaw bones. Also, there are technically two maxillary bones. They are often referred to as the maxilla. They also help form the eye socket in the walls of the nasal cavity. The part of the maxilla into the roots of the teeth are embedded in and is called the alveolar process. The horizontal portion of the maxilla, which forms the anterior portion of the roof of the mouth, is referred to the palatine process. The maxillary bones actually make up, or bony roof of the mouth, make up a greater portion of the palate than do the palatine bones. Also contained within the maxillary bones are the two large cavities referred to as the maxillary sinuses. The mandible is the lower jaw bone, and its main horizontal and anterior portion is referred to as the body, while the vertical posterior portion is called the ramus. The inferior anterior part of the mandible, which we might call the tip of the chin, is known as the mental eminence. Like the maxilla, that portion of the mandible into which the teeth are embedded, the superior part of the body, is referred to as the alveolar process. The point at which the inferior line of the body of the mandible turns upward is referred to as the angle of the mandible. The angle can be easily felt just inferior into the earlobe. The mandibular condyle fits into a depression on the temporal bone called the mandibular fossa to make up the lower jaw joint. Each of the two inferior nasal concha can be described as a bony ridge or ledge located on the lateral wall of the nasal cavity. Just above the inferior nasal concha on each side of the nasal cavity are the similar middle and superior conchae. However, these are not separate facial bones, as are the inferior conchae but are considered part of the ethmoid bone. Besides the cranial and facial bones, the skull contains within 3 pairs of tiny ear bones referred to as the auditory ossicles. Actually, these little bones are located within the middle ear, which is a small cavity within the temporal bone. These bones are all named for their shapes and are called the malleus, or hammer, the incus, which is anvil, and stapes, which is stirrup. They are important to the hearing process as they are involved in transmitting vibrations which result when sound waves travel down the hearing canal and strike the eardrum. These vibrations result in impulses which are eventually interpreted as sound by the nerves and specialized structures located in the inner ear. The hyoid bone is a horseshoe-shaped bone located in the cervical region, just above the voice box. It is somewhat unique that it does not directly articulate in any other bone. It serves as a point of attachment for a number of muscles involved with movements in the tongue, mouth, and throat areas. The bones of the spinal column, known as the vertebrae, are arranged in a way which allows for both strength and support, plus flexibility in movement. Although there are some differences in size, shape, and detail, most of the vertebrae are similar in structure. There are 26 of them stacked on top of one another to form the main support structure of the body, the spine. A side view of the spine indicates that it is not perfectly straight column like you might see in the supporting front of the colonnal style home, but one with significant curvatures. The spinal column serves not only to support the body, but as a protective passageway for the spinal cord, an essential component of the central nervous system. The 26 vertebrae are usually divided into several main groupings, with the upper 7 in the neck area being referred to as the cervical vertebrae. The most superior of these, or C1, is also known as atlas. This is the vertebrae which articulates with the occipital bone and upon which the skull rests. Below the atlas is C2, or the axis, which forms a special articulation with the atlas that allows a pivoting action, enabling the head to be turned from side to side. Inferior to the thoracic vertebrae are the 5 in the lower back area referred to as the lumbar vertebrae. They are designated L1 through L5. Immediately inferior to L5 is the sacrum, which is actually a bone resulting from the fusion of 5 separate vertebrae in a developing child. In addition to the adjacent vertebrae, the sacrum articulates with the 2 hip bones to help the pelvis. The most inferior vertebra, sometimes referred to as the tailbone, is the coccyx. Like the sacrum, the coccyx is a bone which was formed by the fusion of several separate bones in the developmental process. Besides the skull, hyoid bone in the spine, the axial skeleton includes the thorax or chest area. The thorax consists of the thoracic vertebrae, the ribs, and the sternum or breastbone. The sternum is considered to be a single bone, but was originally the 3 segments during development. The superior segment is called the manubrium, the middle segment the body or gladiolus, and the inferior segment of the xiphoid process. There is a total of 12 pairs of ribs, 7 of which are attached by their costal cartilages directly to the sternum. These upper 7 pairs of ribs are often referred to as true ribs as a result of their articulation with the sternum. The bottom 5 pairs of ribs do not attach directly to the sternum and are referred to as false ribs. Of these ribs, numbered 8, 9, and 10 have cartilages which attach them to the rib above. However, the ribs numbered 11 and 12 have no interior cartilages and are called floating ribs. Posteriorly, each pair of ribs articulates with one of the thoracic vertebrae. There are 126 bones in the appendicular skeleton, which consist of the upper and lower extremities, plus the pectoral and pelvic girdles. The pectoral girdle includes the scapula, or shoulder blades, and the clavicles, or collarbones. The medial end of the clavicle articulates with the mandible of the sternum, while the lateral end joins with the superior part of the scapula to help form the shoulder area. The scapula contains several special landmarks, including the acromion, which it is superior lateral projection that articulates with the clavicle, and the coracoid process, which serves as an anchoring point for several muscles. The name of the process is derived from the Latin words meaning resembling a crow's beak. The ball-like superior end of the humerus, which is known as the head, also articulates with the scapula to form the shoulder joint. The word humerus, which is the scientific name for the upper arm bone, actually means the shoulder in Latin. The glenoid cavity is a depression on the scapula to which the head of the humerus fits in order to form the shoulder joint. The inferior end of the humerus contains smooth, curved, articular surfaces called the humeral condyles. These condyles articulate with the radius and ulna to form the elbow joint. As a matter of fact, the word ulna comes from the Latin word meaning elbow. The ulna is the medial of the two forearm bones in superior end, which we commonly think of as our elbow, called the olecranon process. The radius is the lateral bone of the forearm, and both it and the ulna articulate with the wrist bones, or carpals. There is a total of 8 carpal bones in each wrist. The prefix meta comes from the Latin word beyond, and so the bones of the hand, which are just beyond the wrist bones, are appropriately called metacarpals, and there are 5 metacarpals in each hand. Finally, making up the fingers are a series of bones called phalanges, which comes from the Greek word for row. Each finger contains a row of 3 bones, and only 2 in the thumb. This makes for a total of 14 phalanges in each upper extremity. They are not individually named, but are simply referred to as the proximal, middle, and distal phalange of each finger. Thus, the bones of the ring finger on the left hand, for example, would be called the 3rd proximal, the 3rd middle, and the 3rd distal phalange of the left hand. The hip bones, or os coxa, made up so the called pelvic girdle. Like the sternum, each os coxa originally developed as 3 separate pieces, which fused together to become a single bone. The broad superior portion of the os coxa is called the ilium, from the Latin word for flank. Its upper rim is called the iliac crest. The inferior portion, which is part we would sit on, is called the ischium, from the Greek word for hip. The inferior anterior segment is just above the genital region is called the pubis, or pubic bone. Another important landmark of the os coxa is the acetabulum, which is the cup-like area into the head of the upper leg bone fits to make up the hip joint, along with the sacrum and the coccyx. The 2 os coxa help make up the pelvis. The upper part of the pelvis, basically above the hip joint, is sometimes called the false pelvis. The inferior portion is called the true pelvis. The femur is the large bone of the upper leg, or the area we must commonly call the thigh. On its superior end, the femoral head articulates with the os coxa in the acetabulum, and the inferior end of the femur consists of 2 condyles, which articulate with the lower leg bone to make up the knee joint. In addition, the inferior and anterior end of the femur articulates with the patella, or kneecap. The patella slides up and down in a groove on the femur and serves as an important point of attachment for several muscles of the leg. It is often categorized as a sesamoid bone, due to the fact that it actually develops within the tendon of the bone of the femoral muscles. By definition, a sesamoid bone is one which is embedded in tendon. As mentioned earlier, the inferior end of the femur articulates with the top of the tibia, or shin bone. The tibia is considered the medial bone of the lower leg. Along the anterior margin of the tibia is rather pronounced ridge, referred to as tibial crest. On the distal end of the tibia is the projection referred to as medial malleolus. Although it is not actually a bone of the ankle, the medial malleolus is what we may commonly refer to as inside ankle bone. The projection, which we might commonly call our outside ankle bone, is the lateral malleolus. Also is not an ankle bone, but the inferior end of the fibula, the lateral bone of the lower leg. The bones which do not make up the ankle area are referred to as tarsals. There are 7 tarsals in each ankle, one of which is the calcaneus, or heel bone. The bones of the foot, or those just beyond the ankle, are referred to as metatarsals. There are 5 of these bones in each foot. And finally, the bones of the toes are called phalanges, just as though in the fingers are. They're equal in number to the phalanges of the fingers, there being a total of 14 phalanges in each foot. Thus, as one can readily see, of the 206 classified bones in the human body, over 1/4, or 56 of them, are phalanges.